whenever we have a loss of flexion or extension, that's going to be the joint we'll target first. The functional movement that we'll always target first is flexion. Okay? Your patient has to be able to get their elbow up to their mouth to be functional, do their hair and all that other stuff. So as my colleague, I mean, she had probably a almost 30-degree loss of extension in that elbow that she fractured when she was a kid, but she could flex it all the way. It never bothered her. She played golf, she played tennis, she played all kinds of stuff, and the loss of full extension never bothered her, which was surprising, especially playing tennis, but she didn't play it like every day. So, so you can obviously live with a loss of full elbow extension. Hi guys. Just checking in with us every day. But you won't be able to be very happy if you don't get back your flexion, okay? So the ulnohumeral, remember, that's got that olecranon around that humerus that you can't really do a glide. So it's going to look like you're going to distract it and kind of do a rock movement. So it's like a scooping kind of movement. It's not really a glide, okay? If you were asked what would the glide be, it would be a glide towards the shoulder or towards the elbow. Remember this, okay? Hint, hint. Okay? It's going in the same direction. If you want to call it, you could call it an anterior glide. But some people have somehow not figured, anyway, so the glide is going in the same direction that the forearm is going in. So it's going towards the elbow or towards the shoulder, whereas if you're going into extension, the glide's going towards the wrist or towards the floor or posterior, whatever you want to call it. It's just not going that way, it's going that way.
Because it's a female on male.
It's female on male, right. Okay, it's just hard to describe what direction it's going in. Most people say anterior or posterior, but I don't know why. Somehow that got people confused one year or whatever. So, all right. So when you do this, you're going to hook your index finger around the olecranon on the posterior side. You're going to grab a hold of the distal end of the humerus. Scoot this way just a bit. And you'll pin the distal end of the humerus to the bed to stabilize it. Okay? The distraction is not this way. It is this way. Okay? So to distract this, I have to go like that. And then I'm going to hold that distraction, stabilize his, stabilize his humerus, and I'm going to rock. I'm kind of pulling a little bit. I've got his hand pinned to me. I usually say to them, put your hand on my waist. Okay? And I've got his hand pinned to me with my elbow, and I distract it, and then I stand up. Like that.
Well, what'll happen when you get him to 90?
Yep.
You have to use your inner quadrant and outer quadrant.
Oh, okay.
That's why I was saying, this doesn't work, because I'd have to be ending up on top of him. Okay? So then you have to use your quadrants. Now, Earl's got a totally different, Earl teaches the elbow a totally different way than I do. And part of the problem is that I was very, very, very fixed in this methodology when I heard him talk about how he does it. And it was just one of those things that I just was like, I do not have the time nor the motivation to try to figure out what he's doing and why he's doing it the way he's doing it, so I'm just going to stick with my method. okay? So now what's happened is now he never ever used to teach anything on the elbow in level 3 upper, but now since I'm teaching level 2 upper and I do this, he teaches you his way when you come to level 3 upper. So you make sure you get it right. I just thought that was funny. So anyway, but that just goes to show you, and we chuckle about that, but it just goes to show you, you know, there's many ways to skin a cat, and it doesn't mean that one technique is better than the other in all cases. Now, I will say to you that some of the stuff that we do in the neck far exceeds anybody else. I can say that with certainty, because I've tried other things, and they don't work, but this does. But I've used this method on the elbow for years and years and years, and I never seemed to feel like I wasn't, I mean, the elbow is a hard joint to rehab. When it's stiff, it's hard to rehab. No doubt about it. Maybe if I tried Earl's method, I might have gotten a little bit more progress. I don't know, but I didn't want to be bothered learning a new way, so I just stuck to my way. Jim Meadows teaches it this way.